Jane Johnson. I'm co-CEO of AFA, and I'm also part of the Professional Development Committee. So I'm here today with my colleague Andrew. I'll let him introduce himself in a minute, and we'll go through some slides of, that you would have seen probably at the previous workshop, just to nudge your memories about what it is you're doing and what you have to do. And Andrew will keep an eye on the chat, and we will answer questions as we go along. And then at the end, hopefully they'll have some times to wash up with some other questions. So, Andrew, do you just want to do a quick introduction, then I'll start doing the slideshow?
Yep, brilliant. Thank you, Jane. So, Andrew Barraclough, day job is working in analytics at Nottingham University Hospitals, but member of the Professional Development Committee. And for 4 years, I was also Director of Skills Development and part of developing the whole professional registration process. So great to have you with us.
Thank you. Okay, I'm going to start sharing. Now, I have seen that Louise has already put a question in before we started on the area of the context, isn't it? The C section. So we'll go through the slides, and there is actually a part on that. So we'll cover that one in a bit. So let me slideshow. Okay, so I can't see anyone now. I'm just looking at slides. It's taken up all my screens. So I am very much depending on Andrew to keep an eye on the chat there.
Yep, will do.
You've probably seen all of this before because you probably have come to the workshop. So we'll go through them quite quickly to give you more time to answer specific questions for the work you have been doing. So as you know, as a professionally registered AFA member, you go on the public register under the umbrella of FedIP, Federation of Informatics Professionals, who set the generic standards, and AFA standards are made bespoke to health and care. Association of Professional Healthcare Analysts, AFA, who you are all members of, as you know, is a member organisation for analysts, and we are licensed by FedIP to do this registration. It is the only registration route actually for analysts specific to health and care data within the NHS. So that's why we've tailored the standards to this, and it's all overseen. All your applications are overseen by the Professional Development Committee. We do this registration to demonstrate skills and competencies. All your colleagues in finance and clinical sides, they all have to be professionally registered. They have to demonstrate their competencies. They have to collect CPD. They have to show commitment. They have to have validation, etc. And we feel that the same should be true of the analytical community, because the organisations are spending millions, billions of pounds based on analysis by a workforce that has no need, no call to be professionally registered. And we think it's very important for organisations to appreciate the skill that's required of these analysts, and then just really to give themselves that peace of mind that the evidence they're basing all their decisions on is being produced by a competent body. So you hopefully will have already decided which skill level you want to go for. Associate practitioner is for people new into the system who really just need to make a pledge that they will be going for registration at one of these levels within 2 years. So the practitioner through to leading practitioner, well, what's very important, you might in your job, you might be a senior practitioner and think, oh, well, actually, I hit advanced in some of these areas. You have to be able to hit every standard at a level. So you might be able to hit some at a higher level, but you can't apply at that level that would be really your aim for the next time you go through a registration. If you're a leading practitioner, or if you don't have to go up each time you re-register. The re-registration process is actually quite easy. It's nowhere near as cumbersome as the initial applying, but yes, if you're already starting to hit other standards, other levels, then by all means start thinking about doing that for the next time round. You have to use the registration documents that we provide on the website. They are there to download. The professional registration itself, this is what you'll see when you go onto the website, and you can click here for further guidance. You will find examples of reflective practices. You'll find some FA, and you'll click here to apply. So you don't actually, it's not an online application. You download the documents, and when you submit, you upload them back through this hub, which is actually a FedIP hub. So there's a matrix there that shows you which level should you apply for. It gives a very brief outline of the different levels. All the standards have the same title. It's just what's expected at that standard. So autonomy, for example, here, a practitioner level will exercise autonomy subject to overall guidance and direction. A senior practitioner can exercise their own autonomy within certain parameters. Advanced will be able to exercise it, but with much broader parameters and within defined parameters. And obviously a leading practitioner has a much greater autonomy. So all these different things, it's all the same question, it's just the levels of which you reach. So once you've thought, well, actually I'll probably go for this one, then you can start looking at the detail behind. So once you've chosen your registration level, start thinking about the projects and pieces of work. We ask for reflective practices. Three reflective practices is a good number. And you'll find if you pick a big meaty piece that actually you might cover 60–70% of your standards just in the first reflective practice. They don't all have to be major projects, as long as across them you cover the standards and you can provide the evidence of that. So your first reflective practice piece might be for a very large project that you were involved in, and then a couple of other smaller pieces just to wipe up the rest of the standards. And you also have commentary. You can put commentary into the application form itself for just to expand on some of the areas, but mostly the reflective practice will, cover most of it. Then pull together your evidence for what you've been saying and submit by going back to that website and uploading the application and all the evidence. So here's an example of a professional registration, a reflective, go back again, reflective practice. So we use the STAR template: situation, tasks, actions, and results. And as you can see here, the project in this one was identifying frailty and quantify the need for a frailty service. A lot of people get involved in things like, length of stay, demand and capacity modelling. There are so many things that, are quite standard practice that you could bring into this. It doesn't have to be even a one-off project. It could be something that you routinely do, but covers a lot of your standards. So as you write out what the situation is, you're asked to join an MDT frailty team, and looking at the standards, you think, well, actually that covers SP7 and C2. Now, I don't have the actual standards in front of me. We'll get to those further on. C2 is one of those core competencies that I think Louise asked a question on, so we'll move through to those. As you go through, add in your standards that you think you are, it could be communication, it could be how did I decide which what analysis tool to use? How did I decide how to visualize? How do I communicate with my customer to make sure I've got the question right? How do things like equality and diversity are some of the standards that would come into it. So you can say straight away, well, actually, okay, communication, we have these NDTs. Now, the evidence doesn't have to be a script. As analysts, you might think it's a SQL script. It's not. It could be a SQL script. It could be a PowerPoint presentation. It could be a spreadsheet. It could be an agenda showing that you were attendant at a meeting and the minutes show the discussions that took place. That covers your communication. It could be a certificate to say you've done your IG training that year, because there are standards on understanding, obviously, security as well. It could be an email from someone saying thanks for the great piece of work on this particular area. There's all sorts of different forms that your evidence can take, the formats that they can take. So, think imaginatively with your forms. So you've got the actions. What was the situation you were faced with? What did you find out? It became apparent there was many different approaches. And after several meetings and workshops, it was decided we could identify, we'd present the data using a series of charts. So, this could be answering your standard on how did I decide which visualization I would use? How did I decide on my output? And how did I communicate with that with the group? So all these things are probably, and then you could attach that chart as your evidence. The tasks, the actions that you did from the tasks that came out of it. So you'd need to write various SQL scripts. And then here the actions were, how to link the tables and how to obtain the scores that you needed. So lots of different actions there, and the results. And all of these, as you go through, will cover, and you'll see there's an awful lot of standards have been covered there within this reflective practice. The second part of the reflective practice is the what went well, what went less well, what did I learn, and what would I do differently. Really, really important, because the whole thing about progressing yourselves professionally is understanding where you need to improve. So, things will go wrong and you will learn stuff and you will know that next time I will do that differently. Really important that this is why it's reflective. It's to help you understand as well going forward. So although this isn't showing evidence of, what standard did this cover, it's really important because it shows to us that you are learning all the time from the work you are doing. So the application form itself, it asks for a profile. Just, we're not asking for an entire CV. We literally just want a few lines about yourself. If you've had any published papers, have you presented at a conference? Have you done a blog for, say, the AFA magazine? Have you been on a panel discussion? Have you received an Analyst of the Year award previously at AFA? If you haven't published any papers or you haven't spoken at conferences, it doesn't matter, don't think, oh, I can't go any further because I can't put anything in here. It really doesn't matter. It gives us an idea of where you are in your career, but we're not expecting you to have done all this stuff. This is why we are there. We're going to support you through the development of your career. And, you know, we can start making suggestions about, well, maybe write something for the AFA magazine or present, do a show and tell at one of your branch meetings, something like that. And then you can start filling this in for next time. But if you haven't got anything in there, don't worry. And then just formal qualifications that you have. This registration isn't based on your qualifications. It's not based on your job title. It's not based on your grade. It's not based on how many, you know, degrees that you have. None of that. It's based on, can you show us in the standards that you have done this, that you know what you're doing, you know how to apply your skills, you know how to ask questions, you might help train people, and here's the evidence that I can do it. This is for background information. It has no bearing on the actual scoring of the registration itself. Career history, again, you know, one line. What's your role? What was the organisation? A couple, 2, 3 bullets, because we don't want pages and pages and pages. We'll get an idea of you when we go through the registration. There's a matrix here to help you, so you can see what the different standards are. So applying methods in health and care, this is what would have been useful for me to have printed out and had in front of me when I was looking at that reflective practice. So what methods did you use? What methods did you use to solve the problem? How did you organise and plan your workload? Did you have any autonomy with what you were working with? Accountability, responsibility, communication, collaborative working. I remember there's lots of SP7s back there, but it was a part of an MDT. So, you know, likely you'd tick off all of those. Demonstrating professionalism, continued professional development. This is where I say things like, if you've gone to a branch meeting, you know, print off the Eventbrite invite that said, you know, you're coming to this meeting. Print off your IG security, what all your mandatory training things are that you do. If you don't get out, and not everybody can get to conferences, you know, we understand that, but you might have in-house training sessions, or, as I say, your branch meetings. All of those, you're constantly learning and, you know, networking with other people. So put in those agendas from all those events to show that you are continually developing. And of course, if you do collect CPD in the, you know, in inverted commas as such, and you have certificates, save them all as well. I would suggest that you continually build up your evidence throughout your working life, so that's all there ready for you. Now, these standards here are the context within health and care. So impact on healthcare. I know that the reflective practice mentioned a C2 and a C3, so awareness of sectors was probably relevant to, you know, how you worked with the clinical areas and sectors outside of, if you're an acute, how does it work with community on the frailty side, etc. So there's areas there. And I think Louisa's question was about healthcare informatics, the context of healthcare informatics. We'll probably come back to that, but you know, I'm trying desperately to think what I put in there. How does it's evidence-based decision making? That's where we are. That's how informatics fits in with health and care. So without remembering the exact wording of the question, but maybe we can bring that up and help you a bit more with that. So here's a application form example, the demonstrating professionalism. And it just shows, so the following commentary. Oh, and one thing up here, you have additional information. Always pay attention to that, because it's not so apparent in this question, but I know some of the standards, the additional information or up here in this commentary. Don't just, you know, there's a lot of information that might be mentioned in there that isn't phrased as such in the questions. So really pay attention to the additional information aspect. So the standard here provide a short commentary just demonstrating competency in relation to the standard, including reference, etc., demonstrating professionalism, and they would be putting something in the reflective practice and then just fluffed it out a bit here on the application form. So you don't need, you can see it's not a lot. We're not looking for reams and reams. You know, your reflective practice tells us a lot. The evidence tells us a lot. This is just padding out your response. So here's the C1. Sorry, the domain healthcare, the context within healthcare. C4, identify a range of functions within health and care informatics and describe how they interact. I would suggest, I think I had something along the lines of the functions. Health and care informatics covers a much wider range. Obviously, you've got your data warehouse team, you've got your developers, you've got your analysts, you might have performance people within that. So it's really looking at all those areas that deal with data in that whole informatics umbrella, and how do they all interact. You know, you work with the warehouse people because there might be a question on when's this table going to be available. I have some questions on the data quality, so you might work with them. If you have specific developers that might work on, I don't know, developing some Tableau stuff or something like that, you might do it yourself. You might have developing team. So how do you work with them to make sure things are right? Do you then, again, performance and information in some places is all one team, other teams it's separate. How do you work with helping support performance functions? So just think of the wider range of what happens in health informatics, and how it fits, so you understand how it all affects each other, how each part of the process, each part of the pathway can affect the other. So in this example, actually, it looks like they've used a lot, and here you can see they've included clinical coding, data warehouse team. They've kind of answered all these standards together in one commentary, and likewise with these two. So, you know, use these examples to help you. This is the FedIP hub that you will be given access to when you once you're registered, and you can use that to start recording. Oh, sorry. So when you submit, you are given an area on the FedIP hub, and you can use that also for recording things like learning resources and your CPD records. The submission itself, this is what you will see when you go to do the submission. You just literally, you know, as I say, it's not an online application. You'll be saving all this stuff somewhere on your computer and then uploading it on to the system, and it will show you a progress as you upload. So you've got to, first of all, download the application form and then upload the application form, then upload your reflective practices, and the template is there on the website. And then there's a short description there to accompany your submission, and we're talking short, you know, it doesn't have to be huge. And then you can drag all your files into there, all your evidence, etc. And then once it's all in there, submit for approval, and you'll see it all, you know, going off up onto the FedIP hub So the key dates, registration window is now open. Today is the workshop. The registration window closes at the end of this month. So you've got just over a week to, get this done. In February, all the assessors in the PDC group will be assigned applications to assess. So Andrew and myself will receive applications, and then we have a month to go through and do that. Now we will say, if we want you to do this, we want to help you get through this registration process. If we feel there is something missing, but everything else looks good, we'll drop you an email and say, look, can we just jump on a call for 10 minutes and just discuss this one standard? Or you've done all this, but you haven't actually evidenced this. Could you just send me a copy of your SQL script? Or you might feel you haven't been able to submit evidence because of IG. So again, it might be, well, can you get your line manager just to drop an email to confirm? So I know. We don't go out of our way to fail you. We go out of our way to pass you, and we would rather make calls, set up little meetings, ask for extra information. It's not a case of once you've submitted, well, that's it. We will keep, contacting you if need be. Sometimes we won't. Sometimes if we don't contact you, don't worry. It might mean that everything's perfect and we've got no further questions. But we won't, stop you from getting through just because we were missing one bit of paper. So I'm going to stop sharing now because then I can see everyone, because at the moment I can't.
So talking of missing things, we do have something that's been flagged by Louise, which is a good one, which is, in the reflective practice, we talk about that second page, those questions of what went well, etc.
Mm-hmm.
We don't have those in the application forms at the moment. So I
What,
think
the
that's
reflective practice?
Yeah, we've got the table which has the star.
Oh, but we don't have
we don't have those second set of questions. So I think that's just an oversight on our part, isn't it? Because we used to do it as a PowerPoint, didn't we? We must have pulled it into the Word document, but we haven't got that second set of questions.
Okay. So, right. So anybody that needs that, anybody who's submitting now and, needs that, yeah, we need to get something out to you quick.
Because it's just adding those 4 questions, isn't it? So it is just 4 boxes, but we just need to make sure that everyone knows that that is the case, that we do need that.
Right. So, is Lizzie here? Yes, Lizzie's on the call. Is that something we can pull from previously, Lizzie, and put it up? We'll sort it out and we'll get it put onto the website. Right. Can you advise when the next submission window is? So it's quarterly. If you don't get it done at the end of this month, it'll be
so it's April, isn't it?
April, yeah.
Yeah.
So yes, it's a 3-month cycle, just simply to help us, organize our workload. So we know once every 3 months we're going to be bogged down with applications, and we got 2 months to get our work done in between. So there used to be no window, and it was just impossible for us to work that way. So that's why we have the windows now. So yes, April. Oh, and you've already answered that. Well done. In fact, I'm not even, read what you've done. Why is what went well bit not on the December 20? Oh, that's the bit you've just mentioned.
Yeah.
Okay, so we need to get that sorted.
So we've got another question from Caroline.
I'm not
Which level to apply for?
Right, so the associate practitioner is not, it's not the same. So if you go for associate practitioner, you do not get all these standards to answer. You have to do a write a bit about yourself, what you do, what you're aiming to do, and pledge that in the next 2 years you will do a full registration for one of the levels. So in your case, your first registration would be at practitioner level. If you go through all the questions for practitioner, if you've been in the business long enough, you may well be able to cover all of those. But if you think you can't, and you're pledging to apply within 2 years, but you might do it in the next window. So you could go in and apply as associate practitioner, today. And we're just saying, just promise us in 2 years you'll go for the full registration. You might decide at the next window you're ready to do that. You might think, well, actually, no, I'm going to work at this job for a year. I don't know how long you've been in the job. You come from a university research background and now work for the NHS. So you're fairly new into the NHS, possibly, Caroline. I don't know. But if you're not comfortable at being able to answer all the levels of practitioner, apply as an associate. You will still be on the FedIP register, but it just gives you time to, up your level with the next set of applications. You don't have to do it in 2 years from now. You can do it any time over the next 2 years. The other thing to point out is your membership for AFA is either £37 or £47 a year. And your FedIP registration lasts 3 years. There's also £25 a year to be paid for your professional registration, which is a lot cheaper than your nursing and finance colleagues. And it's also a lot cheaper than BCS, which is about 130 quid. So, just saying. You cannot be an AFA registered professional on the FedIP register if your AFA membership lapses. So if you get your FedIP registration on this submission, you are on there for 3 years. However, if your AFA membership lapses, you will be removed regardless of how long of those 3 years are left. So basically you have to have both running concurrently, your AFA membership and your FedIP membership, because you are effectively a member of both bodies. So you're not sure, go for associate practitioner, give yourself time to get your feet under the table and apply as soon as you feel comfortable for the practitioner level. Stephanie.
Hello, hi Jane, hi Andrew.
Hi.
I've got a sort of team question. I'm thinking about, I've got a team. I work for MLCSU and I've got a team of about 13 analysts. And 2 of them have got their accreditation, which is amazing. So I'm feeling like I really need to get on board and do it myself. But from a personal point of view, I'm not that hands-on anymore. So I just wonder if you've got any advice for where, I might not have a report or a dashboard per se as evidence. And I do need to think through which level to apply for as well. Yeah, but just a bit of advice really, because the stuff that I do is a little less tangible than, do you know what I mean?
So I'll just bring in your question. Also, Maria's just said, can you apply directly for senior practitioner or do you have to go as associate? No, you can apply first time round as a leading practitioner. You do not have to work up through the levels. So in your case, Stephanie, you'll probably find that if you went to the advanced or the leading, because they are more strategic roles, especially the leading practitioner, and you're more about strategy and team building, but you have a good understanding of what analysis is needed. You have a good understanding of what is needed to deliver good evidence. Then it might be that, because I haven't written a script for over a year, I'm in as a leading practitioner,
Yeah.
But you know, a lot of the stuff I do is strategic team building, working across systems. Yeah, so it's if you
Okay.
can't evidence writing a script, it's not because you're not worthy, it's because it's not what your role requires
Yeah.
of you. So
Yeah.
do look through, you know, that higher level to
Okay.
see if that covers a more strategic. Talk to, because Neil's MLCSU, isn't he? I
He
think
is,
he's
but he's a
leading.
BCS. He did it through BCS.
Ah.
Did
I
he?
know. I can't believe it.
Well, I've worked with him. We've got a
Yeah,
meeting
I'll
with
have a
him this
think
week.
about it because
So
we've rolled out NCF and BI in ML, and that's what I've been doing for the last however many months, and lots
right,
of things like that.
which is your reflective practice piece, isn't it? I mean that.
Yeah.
So yeah, it's because you're working in a data and analytics field. So you're doing that. That's fine. So then it as you're moving up, because this is absolutely what a number of us went through when we were going
Yeah.
through this process of, it could be many, many years ago, if indeed we've ever written scripts, and that's fine. It's are you working in a role now, and can you demonstrate the relevant level of competencies? If you're leading
Mm.
analytical teams, you're making decisions about the nature of teams, you're rolling out the national competency framework, you're developing policies, you're developing understanding business domains, and then making decisions about
Mm.
analytical techniques to use, but that doesn't mean you're using them. So it's about absolutely about the
Yeah.
level. You're working in a data and analytics field, and you can talk to relevant things, which is developing strategies or policies
Yeah.
or teams or decision making. Those are all perfect. It doesn't have to be, and
Okay.
it's not that it's cumulative. So it's not that you have to go back and prove you've written scripts in
Mm.
order to get all the way up. Definitely not.
Yeah. Okay. Thank you. I feel like it's my birthday when I get to do a SQL query. Thanks very
I mean,
much.
you know, there's other things as well. Like I know the powers of Python, but I can't write it. But
Mm.
it's having an understanding of knowing where things can help. So you don't necessarily have to be doing or people in my teams have been much better at R than me.
Mm. Mm.
Um, but I know what I want from them and I understand what has to come from it. So yeah.
Mm.
Kenneth, what's the difference between registered and being accredited? We don't talk about being accredited. This is a professional registration to go on a public register of registered professionals. Accreditation is something we really talk about when we're talking about courses and stuff. Are they accredited courses? Maybe, or I don't. It's accredited isn't something a term that we use of ourselves. We just talk about, are you professionally registered? Um,
And it's also then the difference between being a member of AFA as a membership body, which is the, are you in the band 2 to 6, and then to be a member of AFA, there's a certain charge for that, isn't there? And then once you get above that,
oh,
there's a different
oh, I see
charge.
what you
So it's
mean.
that AFA membership as well, which is
Yeah,
different to then what you've just described, Jane, which is the professional registration, isn't it? So
yeah,
that's the additional process then that you go through to get onto the FedIP
yes.
register, public register.
So
So there's a membership and professional
the
registration there as well.
so the membership of AFA gives you all the stuff like your branch networks, your monthly newsletters, your networking, your annual conferences, mentorship programs, blah blah blah. And one of the other offerings that AFA gives to members is the opportunity to register yourself as a professional on a public register, which is supported by FedIP. So if you registered with AFA, I see what you mean. Yeah, sorry. So if you joined AFA as a member in the 2 to 6 band, then all that gives you membership to AFA. If you want to apply for professional registration, that's where you then have to go through this whole process we've talked about. So this meeting today, Kenneth, is more Q&A for people that have started it. You might be better going to the next workshop. There's one every month anyway, or 2 months. We do 2 workshops, one to really give you an idea of what the registration is about. So being a member of AFA doesn't give you registration. that's a whole different process. If you're a band 6 analyst, it doesn't make any difference to, you know, you might apply as a practitioner level, you might apply as a senior or an advanced. That's why I say the professional registration has nothing to do with your qualifications or your job title or your grade. It's to do with your ability to evidence what your skills are at that level. So, you know, you could be a band 6 but still go for an advanced, depending on what's required of you in your role and your ability to evidence that. Then you go through this process, then you go on to the Fed IP register, public register, as a registered professional.
And is it worth us just partly thinking of Maria's comment as well of you have to be working in health and care data and analytics at the moment, don't you? And some of what we expect relates to that context. So if you're working in a bank, this wouldn't be right for you because it's in health and care analytics. But when we talk about the reflective practice and the evidence, then we expect that to be within the last couple of years, don't we? So it's got to be recent, but it could be, so there could be, as long as you're working in health and care analytics now, there could still be things that you're bringing from a previous role that, if they demonstrate the kind of data and analytical activities that are relevant to your role now, but you've got them from a previous experience, they could still form part of your reflective practice as long as you are in health and care now. So that case, if someone's been in the NHS for 18 months, well, you're in health and care now, and you're going to have some examples that you're going to be able to talk to from health and care. That's great, but there could still be something that was relevant from a previous role that you could bring to bear that can meet a specific standard. So there could still be something that's relevant from that previous. It's not that you have to wait to build up 2 years or more just in the NHS. As long as you're in health and care now, you can give us something from that, but there could be things you can bring in from a previous role as long as they're relevant to our standards.
So the evidence doesn't have to be from your job today. And also we do obviously like it to be fairly new, but there are certain things like in the leading practitioner, it might be a case of, well, I wrote a 5-year business case or, you know, business plan. Well, obviously, you know, it might be due next week and it's 5 years old. We accept that some things are going to be older simply because of what they are. But if you can have more recent examples, but it doesn't have to be in your role. You might have changed jobs last week and you're thinking, well, I don't have anything built up yet. It's from your previous job as well. Yeah. Anything else? Any other questions? So we've just got to make sure we get that form onto the page on the website there for people.
And I mean, anybody can start working on those 4 headings now, can't they? Because it's not that.
Oh, and then just copy and paste it into the template.
Yeah. So we need to correct it, absolutely. But it is just answering those additional 4 items of the reflective practice, isn't it?
And I think the example is on the website of the full reflective practice. So, yeah. Can you add it to the chat in Word format? I personally don't have it. I would have to go back to, but we'll get it put on the website. So I think Andrew's put the slide on there just so you can see the headings. So if you start looking at the headings and writing it out, we'll get the template onto the website because we don't have it ourselves. It's probably held by Emma. Then when it's there available, then you can download it and just copy and paste all your answers straight into the template.
And because so we obviously have sent out the invites for this, haven't we? So we could probably get that template sent out to the people on this call.
Yes.
Because we could do that just to make sure there's not a delay in that as well.
Yes.
Lizzie will be able to do that for us, won't she? Just to speed things up as well. Well.
Hopefully, yes. Okay.
Well, sounds
Well,
good.
good luck, everyone.
Yeah,
Thank
look
you.
forward to those applications.
Yes. Okay.
Well,
Thanks.
thank you
Thank
all.
you.
Bye.
Bye.
Thank you. Bye.